लहान आहे तुझा बाळ तरी तू सांभाळ.
The 2018 Global Nutrition Report shows that India accounts for almost 31% of the world's burden for child stunting, that is, low height for age. Half of the world's wasted children, meaning low weight for height, are in India. According to the National Family Health Survey 4 of 2015-2016, the nutritional status in rural India shows 41% of children under the age of 5 have poor height for age, while 21% suffer from poor weight for height. 38% of Indian children are underweight. Around 60% of children below 5 years of age and 54% of women are anemic. It was found that states with large rural population also show high levels of undernutrition. Is it possible to use agriculture and our agri-food systems to better the nutrition status of vulnerable rural populations in the country? This challenging question was taken up by the Leveraging Agriculture for Nutrition in South Asia Research Consortium, LANSA, to investigate an evidence-based approach under the leadership of MS Swaminathan Research Foundation, MSSRF. Funded by the Department for International Development, UK Aid, the LANSA program, among other studies, undertook an action research feasibility study called Farming System for Nutrition, FSN.
I conceived the idea of farming system for nutrition only because it is probably the most effective, most economical method at the household level, at the village level, at the national level. You mainstream nutritional dimension in the design of the farming system.
This research idea was piloted in 5 villages in Wardha district, Maharashtra, and 7 villages in Koraput district in the state of Odisha. Both districts suffer from high levels of malnutrition and were chosen to examine feasibility of nutrition-sensitive agricultural interventions on the ground.
The FSN study began with a detailed baseline survey in the villages that were selected to understand the existing occupational pattern, the socio-economic structure of the villages, and also the nutrition status. The nutrition status we found was in line with what the district level data showed, and there was high level of undernutrition, stunting and underweight among children below 6 years, high level of anemia, micronutrient deficiency, vitamin A deficiency. High level of anemia among women and adult men, both men and women suffering from chronic energy deficiency or undernutrition. And the diet survey that we did revealed that the diets of the people was largely cereal dominated, with consumption of all other food groups being less than what is recommended in terms of the farming system for nutrition design, improving the dietary diversity of the households as a first step.
To arrive at this understanding, several consultations were organized with relevant stakeholders, especially the farmers and their families. MSSRF scientists found that village communities in Koraput ate ragi, finger millet, and in Wardha they had jowar, sorghum. In both places, farmers did not grow enough to meet home consumption and were actually buying the grain from local markets. They were gradually encouraged to grow the nutrient-dense ragi and jowar crops with improved seed varieties and package of practices. This narrowed down the household demand and supply gap. It turned out to be the same situation for pulses.
What we tried to demonstrate was have farmers see what they were doing traditionally and compare it with the innovations that we introduced in terms of improved variety of seeds, improved package of practices, and the results in terms of the yield, the economics, the benefits. And This we felt was very important for gaining their confidence and also for the process to sustain. In Wardha, where they intercrop PGNP with cotton and soybean, an improved variety of PGNP was introduced that yielded twice as much as what they were getting earlier. And in Koraput, where they were not cultivating any pulse during the Kharif period, maize PGNP intercrop was introduced, and so instead of just a crop of maize, they were now getting an additional PGNP crop at the end of the season. Pulse diversification was another process. There was no green gram or black gram being cultivated in Wardha, but again introducing this was readily accepted, and at the end of the project period we had 25% households cultivating green gram and 19% of the households cultivating black gram in Wardha. And we even had some farmers who were cultivating PGNP as a sole crop.
Farmers in Wardha grew the more wilt-resistant chickpea variety that MSSRF introduced in the Rabi season and saw an increase in production of 37%. More farmers cultivated jowar in Wardha, and production was higher than first recorded at baseline in 2014. Ragi had a six-fold increase in yield, and 50% farmers were cultivating the crop compared to just 29% at the beginning of the FSN study.
We found that there is high prevalence of anemia and vitamin A deficiency in under 5 children. We have introduced orange flesh sweet potato along with other fruits and vegetables in the nutrition garden. Earlier, farmers have not cultivated orange flesh sweet potato, but at the end of the study, we found that they started cultivating and all the produce were consumed at the household level.
Nutrition gardens were promoted at community, household and school level to encourage the village community to grow and eat fruits, as well as all groups of vegetables. Seasonal calendars were developed to distribute the fruit and vegetable seeds or sapling. Also, awareness programs on the benefits of eating fruits and vegetables were organized for better community acceptance. Communities were encouraged to maintain backyard nutrition gardens in available homestead land, and community nutrition gardens were managed by women groups on common village land. Produce from the school nutrition gardens were used for the school midday meal for children.
At the end line, we found that 89% of households were growing fruits and vegetables. Earlier, they were growing 1 or 2 vegetables. And at the end line, we found that they have started growing leafy vegetables and roots and tubers.
Livestock has always been part of a farmer's life. They are widely used for cultivation and rituals, bringing in additional income for their owners, especially during festive occasions when goats, chicken or fish are eaten. The baseline survey, however, did show that community diets had low animal protein, much below the recommended dietary intake, and so MSSRF included fishery development for Koraput and backyard poultry for Wardha as part of the FSN intervention. As Lansa came to an end, around 9% of households in Wardha had poultry, enjoying an average production of 50 eggs and 25 kilograms meat annually, provided a model for other farmers. In Koraput, 32% households that had access to ponds began fishery, and there was an annual average production of 37 kilograms from a pond size of 1,000 square meters.
In both Wardha and Koraput, we found there was increase in the number and quantity of food items being consumed, the frequency of different food groups being consumed. Koraput saw a significant improvement in the household dietary diversity score, where there had been only 19% households with a HDDS of 6 at the baseline. There were now 42% households, and this in itself was very encouraging.
Along with the FSN interventions, we introduced community hunger fighters approach and nutrition education programs to facilitate the nutrition messages and linking agriculture to nutrition to the community. So these community hunger fighters were selected by the community and trained by the MSSRF on nutrition. Nutrition calendars and charts were prepared on balanced diet and were distributed to the households, schools, and government institutions to widen the reach of nutrition messages.
Links between agriculture and nutrition were explained at several stages during village meetings, training programs, and technical sessions. Also at plant and animal health clinics, programs on value addition, focus group discussions, on-farm agricultural demonstrations, and exposure visits for farmers. To ensure that the principle of FSN continues with the farming community, MSSRF initiated the Farmer Knowledge Centers, community nutrition gardens, and community seed banks to ensure availability of seeds. Besides these efforts, the community hunger fighters are expected to sustain the FSN approach in the villages.
A large number of farm men and women in the core set of 12 study villages had taken to the farming system for nutrition interventions that were introduced both at the field level and at the nutrition garden level. There was increased awareness among the community members. Farmers from the neighboring villages had also started practicing some of these interventions. This happened by word of mouth, by farm men and women from the core study villages becoming the spokespersons, and they emerged as the torchbearers or the champions of this approach, speaking at public forums, at government meetings, sharing their experience and how this was benefiting them compared to what they were doing earlier. Given that we are a country dominated by small and marginal farmers, farming system for nutrition approach can help ensure household level food and nutrition security. Taking this into agriculture policy and practice will help address the challenge of malnutrition.
Time has come for us to think hard on it, and going back to the farming system is the best method of attacking the problem at its roots. I am confident that for the first time the challenge of zero hunger by 2025 can be met.
Tony.